There are so many problems that you might bring to therapy and so many different therapeutic modalities. So let's go through every single possible option. This is part 2. Today we're talking about treating anxiety with CBT. Now, if anxiety has you stuck in a cycle of overthinking, CBT might be your exit strategy. CBT, or cognitive behavioral therapy, works on the idea that our thoughts, feelings, and behaviors are all connected. Anxiety often starts with a thought that feels true but isn't necessarily accurate. CBT can help you catch that thought, identify it, and then choose to respond and reframe it with something that fits better. Take this as an example. Let's say you text your friend and they don't respond for a while. You may start thinking, oh, is my friend mad at me? This type of thought can easily trigger anxiety. With CBT, you'd pause and you would ask, is there another possible explanation for why my friend isn't replying? For example, maybe they're busy, maybe they're at work, maybe they just haven't got back to their text yet. When you can think of other plausible explanations, the anxiety kind of loses its grip because you start to realize, oh, the thoughts I'm having maybe aren't super rational or necessarily true. For each thought, you're going to write down 3 alternative and realistic explanations. Basically, what happens is over time, the more you practice this, your brain will stop defaulting to that anxious thought and it will slowly start realizing that, okay, there's actually other things that might be going on here. Your brain will eventually feel comfortable and realize that just because a thought is loud doesn't mean that it's true, and the anxiety will kind of lose its grip. If you want more tailored help, because obviously this is just a very basic approach, then you can click the link in my bio and we can work together to combat your anxiety once and for all.